Hello and welcome back. My name is Hannah with Twinkle Tools Craft Co., formerly Iridescent. Today our video is going to be about what the heck is my doctor saying? So, taking charge of your health should be easy. However, sometimes we find ourselves in situations where we're given lots and lots of education, but you don't really understand all of it. So I'm here to shed a little bit of light on that. I work in the healthcare field, but I'll just give you a little disclaimer. If you have any questions, I want you to reach out to your healthcare provider because they know all of your history, all the things that make up your story, and can give you the best advice for you. So with that being said, let's dive in. The first term we'll talk about is positive and negative. So you would think positive is something good, and negative is something bad. But when we speak of positive and negative in terms of lab values, positive means that you do have it, and negative means that you don't have it. So sometimes that could be a little bit confusing. So, for example, if a doctor says that a lab test is negative, it means that the test did not find anything abnormal, which is actually a good thing. Another term that can be confusing is acute and chronic. So, acute is any condition that happens suddenly and is usually severe. Chronic is something that's been going on for a while, a very long time, and could last for even a lifetime. So, for example, an acute thing would be something like a heart attack. A chronic thing would be something like asthma, something that's been going on for a while, maybe since you were even a child. The next term we'll talk about is remission. So remission is usually a term used to describe a period of time where a condition is not active or not causing any problems. So it's a good thing. It doesn't mean that the disease or condition is cured, it just means that it is under control. So another term that can be confusing is benign and malignant. Benign and malignant are usually terms to describe tumors or growths. A benign is something that does not have cancer and is not usually a serious health threat, and you can usually just leave it alone. A malignant growth or tumor is something that is cancerous and can be life-threatening and usually spreads like crazy. So that's what those two terms mean. The next term we'll talk about is prophylaxis. So when you think of the word prophylaxis, I want you to think of preventative. Prophylaxis basically is using medication to prevent another disease or another condition from occurring. For example, you take aspirin to prevent a heart attack, or you take antibiotics after you've had a surgery like a mouth surgery to prevent an infection. That's what prophylactic antibiotics is. The last term we'll talk about is hypertension. So hypertension is another term for high blood pressure. And I'm going to get on my soapbox for a little bit, just because I feel like this is a very serious health concern that a lot of people don't really take into consideration and don't take seriously. So another word for hypertension is the silent killer, because it could be doing damage to your heart, damage to your vessels, damage to your kidney, the small little vessels in your eyes, and you won't even feel it. So when you go to a doctor or you go to a clinic and they say that you have high blood pressure, that's something that you don't need to dilly-dally on. You need to take a look at your lifestyle, see if you can adjust your food choices, eat less salt, avoid foods high in cholesterol, fats and things like that. Exercise so that you can improve the health of your heart and your vessels, improve your endurance. Hypertension can also be genetic. But a lot of times lifestyle changes can help as well. Of course, you need to talk to your doctor because they know all of your history and all the things that make you, so they'll be able to make the best decision with you for you. But I always like to tell my patients and, tell my friends and family if their blood pressure is getting a little high, even if it's in like the 130s over 90s, that's something to pay attention to because it can grow and grow silently. And you don't want it to fester and get so out of control that it isn't manageable by diet anymore. When a lot of times, when it's not genetically caused, it can be fixed with dietary changes. So I'll get off my soapbox now. I just really, really think it's a very serious health concern because it can increase the risk of heart disease, stroke, and other heart problems, or health problems. So lastly, medical terms can be confusing, but understanding their meanings can help you better understand your doctor's diagnosis, your treatment plan, and your care. Remember that positive does not always mean good, and negative does not always mean bad. If you have any questions or any concerns about your health or your medical treatment, don't hesitate to reach out to your doctor. And if there's any other terms that you come across that are a little bit confusing, you can leave them down in the comments and I'll try to answer as many as I can. My other healthcare providers that may be watching, you can help out, answer any questions or any comments that you see down and below. And hopefully this helps you a little bit on your journey. Thank you for watching. That's it for today's video. And please take care of yourself. I'll see you in the next one. Bye-bye.